We're going to now talk with Dr. Susan Koletar, the Director of the Division of Infectious Diseases and Principal Investigator of the AIDS Clinical Trial Unit at The Ohio State University. Doctor, thank you very, very much for joining us. We appreciate it.
Thank you.
Well, one of the reasons we asked you to come in today was a report that came out a day or so ago from the World Health Organization, which seemed to say that it's rare for someone who does not have symptoms to transmit to their contacts, someone who does not have those symptoms. And we've heard a lot of discussion in the last 24 hours about this, and I just wanted to see if maybe you could tell us a little bit about what your perspective is of this.
Well, thank you, Governor, for the invitation, first of all, and secondly, for the opportunity to say we continue to learn something new every day about this virus and this disease. So today's no different. I think what's important is definitions here. When we talk about asymptomatic, we're talking about people who truly have no symptoms, and importantly, never go on to develop any symptoms. And I think that's a key feature. Pre-symptomatic are people who may have some symptoms, but really not enough to cause them any alarm or bring anything to attention. Maybe a little bit of fever, maybe a little bit of sore throat. But then those people go on to develop more classic symptoms that we think about when we talk about COVID. So I think that's an important distinction. When you listen to the, if you listen to the WHO briefing yesterday, I think the comment was, it is rare for people who are asymptomatic to transmit infections. And I want to put that into some perspective. I'm not sure we actually know how many people who are truly asymptomatic actually go on to transmit infections, because we've not done that type of contact tracing. But what is important is that, and I think we do know that people who have symptoms, who are pre-symptomatic or just at the starting of the virus really multiplying enough to cause symptoms, they are likely infectious. We see this in influenza too, so it's not actually surprising, and I think it's that group we need to focus on. I hope that answers your question.
Well, yeah, and I think that I have to let that sink in just a little bit, but you know what you started with, your statement that we continue to learn, is certainly true. You know, it is for me as a layperson who's trying to understand exactly what is going on. So what would you say then, from what the World Health Organization's statement, what do we do with that? I mean, what practical significance does that have, do you think?
I think we do what we've been doing, quite honestly. We try to assess people with symptoms, and actually with actual testing and tracing, we try to continue to increase awareness among the public at large of what the symptoms might be. And then I think we need to pay attention to the issues that we've had in place for a while. The ideas of social distancing, the ideas of hand hygiene and routine hand washing, and how we put that into context is, I think, an important way to continue to deal with the virus. The other thing, and perhaps one of the things that people have talked a lot about, is the idea of masking. And that in particular, I think, is really related to that pre-symptomatic potential for spread, both from the source, the person wearing the mask, that we would consider the source patient, to other people in the public. So when everyone is wearing masks, that decreases the likelihood of transmission from one person to another.
So let's say if I am, it turns out, as we look back on it, I am pre-symptoms, and then in a few days I get the symptoms. Let's say today I have no symptoms, but in 2 days I get symptoms.
Correct. That would put you in the pre-symptomatic category.
I'm in that category. Now, does that mean that I'm likely to be able? Would I be contagious if I go home and see Fran, which I'm going to do when I leave here? Will that? I mean, if I was in that situation today, I didn't know it. She wouldn't know it.
Correct. So I guess the real answer is yes, you are contagious, or you should consider yourself to be contagious, and that's why, particularly outside of households and in public, we need to think about things like masking. Now contagious infectivity is related to, again, space and distance. So the closer you are together, and the longer you spend time in that closed space, that increases the likelihood of transmission and acquisition. If you're living in separate rooms or in separate houses, then...
So we don't, doctor, really, we don't.
I wasn't making any implications. I was just trying to put into some perspective. So yes, so I think that's why we always need to be really, really cautious of how we feel and what we're doing in terms of our space and time.
But I kind of set up the wrong question. The real question would be, though, if I don't know I have symptoms, and I could spread that to somebody who I don't know. Let's say I'm out and not social distancing and don't wear a mask, and I do not know that. So I guess that's the summary of the reason to wear a mask, is because you just don't necessarily know.
Yeah, I think, again, people may not, or may not be even aware that they're having any symptoms. And I think that's the sort of that critical period where the virus is multiplying enough that it can, again, the viral load, if you will, is high enough that it will be more easily spread. Again, more easily spread closer to the distance and the longer amount of time in that distance.
Okay, doctor, anything else we should know?
No, I think we should continue to learn things every day. I'll emphasize the things that we do know. Hand washing is important, not just for COVID, actually, just in general, but infection prevention and good health. Social distancing, or physical distancing, I guess is a more appropriate term, really does make a difference until we really get this virus under control. And then wear a mask when you're out in public, because we don't actually have the answer to the pre-symptomatic spread, which I think is real. And I will leave the hopeful note that I think we are continuing to learn things. New treatments are being evaluated, and vaccines are being evaluated as we speak. So thank you for the opportunity, Governor.
Well, thanks for ending on that hopeful note as well, doctor. Thank you. We appreciate it very, very much.